Hello everyone, and a very big hello to all my dearest interns. You have done it. A very big congratulations to you. You are a doctor now, and I am so happy to welcome you on the other side of the journey. The side we are, craving to be on since I think when most of us were like 2-3 years old, 5 years old. It is a dream to be a doctor, and you have achieved it. You have made all of your parents so proud, you've made people around you so proud, and you should be proud of the chronic effort and the diligence it took to be a doctor and it took to be here. You are an intern now. It is a very new phase of life, it is a very interesting phase of life, and hands down, the most fun phase of MBBS is internship. You earn money, you are a doctor, you get respected. I think it was something which I will cherish throughout my life, my internship. But that does not mean that you give up on NEET PG. You stop thinking of the long term and just focus on having fun in internship. You need to understand that NEET PG 2026 is around the corner, and also INI-CET November is very near. So here I am, Dr. Pratha Gupta, first year postgraduate resident in Department of Dermatology in UCMS and Guru Tej Bahadur Hospital. I secured a rank of 500 in NEET PG and a rank of 504 in INI-CET May. Both of these exams were my first attempt right after my internship in Lady Hardinge Medical College, which was a very joyous time in my life. So, how to juggle endless duties, how to juggle fun, and how to be, diligent with your effort, and how to be honest with your effort for NEET PG and INI-CET. Here I am guiding you through it. So internship is a very challenging time as well when it comes to academics. Why? When you wake up, I remember when I used to wake up around 8 a.m. there was this constant pressure that you have to rush to the hospital, because here you can't bunk now. As an intern, you are kind of more responsible than you were as a UG. So you have to rush to the hospital. Then there you would be made to do a lot of groundwork. You have to rush for reports, you have to take out samples. You're almost always on your feet. So where are you going to get the time to study? But everybody tries to make out some time, like I did, a lot of my friends did, and they are all pursuing great branches and great institutes. So, of course, time management is a very challenging task with the internship. But of course, it is something everyone can, get through with a very strong and proper strategy. Also, there is a problem which I faced during internship was that I could not reach to the end of any subject. A lot of times, I had to leave the subjects in the middle because it was taking just too long to complete a subject. I think that is not a very bad strategy, because you can never do 100% of anything. So it is better, do 70-80%, go to the next subject, because that kind of gives you a rhythm. That gives you a pace. If you're stuck at the same subject, neither will your scores go up, neither will you perform well in GTs, and you will kind of feel irritated, agitated that nothing is going according to my plan, let us just simply give up. So very when I cracked NEET PG in my first attempt, everybody said it is an anomaly to do so, because people don't generally get great ranks with a very hectic Delhi internship. But trust me, that is not the rule. It has all changed now with the abundance of resources right now, with the abundance of great apps. You can do it in the very first attempt. It is not an anomaly to crack it in the first time now. It is rather normal. A lot of people did it alongside me, and I see so many people putting in the effort on a very regular basis, and I'm sure they will crack it in their time. So for that, you need to understand that as an intern, there will be a constant urge, let me give up. I will just do it in the next time. Let me have my fun right now. Let me, spend my first stipend. Let me enjoy these last few days in college properly. But that is a very, short-term mentality. Think about the long term. What will, it is not very easy to sit for 1 year at home and then just study and focus on cracking the exam. It comes with a lot of pressure. But so you need to understand that as an intern, you are giving a relatively stress-free attempt. Because in this attempt, a lot of people are not expecting that you are going to crack it. And even you yourself give yourself, a kind of leeway. Koi nahi agar nahi hua to. It is alright if things don't happen my way. It was my first attempt only. I was also, working alongside. So that lack of pressure sometimes helps like a lot of people. Like it really helped me because I was kind of, pressure free ki koi nahi agar nahi hua to we will manage in the next year. So I feel that is a very, very big advantage of being an intern and then giving the attempt. Also, as an intern, we kind of lack discipline most days. We are like, okay, ab duty khatam, now let's go for a party. Of course, party. Everybody parties in internship. Even I partied a lot. But you need to understand that you can party once a week. But the other days, you have to be very diligent with your effort. So for an intern, what should their day look like? Like when I used to, have crazy hectic duties like Ops and Gynae or medicine, what I used to do was, I used to wake up around 7, go through a custom module of any subject and then rush to the OPD or the ward wherever I am posted. There I used to do the work, and then when I am going to collect the sample, I would simply, have my phone on and, just read BTR, go through a topic, and whenever there is a case around me which is, very basic MBBS thing, something which I have read in my notes, I would always make it a point to revisit it then and there. So kind of keep your brain open at all times so that you can learn the maximum out of the atmosphere around you. Because as an intern, you have a very big pro that you are currently in the hospital, you are currently in the surrounding where you will be tested from. You will be asked from what is happening in the hospital. You will be asked hospital relevant stuff most of the times. So as an intern, you are actually seeing it happening around you and you don't need to put an extra effort memorizing it. That will just, come spontaneously to you if you have your eyes and ears open. So there are perks to being an intern and preparing for NEET PG as well. Also, you need to understand that when you are in your internship, you are just freshly out of final year. Final year, it is immensely high yielding in NEET PG. It is immensely, sought after. A lot of questions come directly from final year, and you are just out of, reading properly for professionals, preparing for theory papers. So you are kind of on a stronger side for these subjects. Why waste it? Why, forget all the effort you had put in final year and ruin all the effort you had put in cracking those professionals by not studying an internship? Rather, if you build on that final year base you have, let me, assure you that you will be very strong even with your first and second year subjects. Because with me, what happened was, I was not a very, sincere student since the first day of college. I partied my way through first and second year. I got very sincere in my final year and internship because I wanted to get done with it in the very first time. I thought I will, give it my best, and I was kind of very hopeful that no, if I put in sufficient hours, if I had the correct mindset, proper strategy, I will get done with it. So in that regard, I made my final year my base and I revisited first and second year topics through final year, and that made it very interesting and very easy for me, and also correlated and kind of made a very interconnected, beautiful web in my brain. So interns, a lot of time I am receiving a lot of DMs and questions like, ma'am, kitne time mein kitna karna chahiye for an intern, because there is no time foundation exactly, because you have months where you are stuck with medicine, you have lighter duties like community medicine. So you need to be aware in which chunk you are getting time, in which chunk you're not getting time, and always plan your schedule accordingly. So a lot of times I'm receiving many questions, many DMs from interns. Ma'am, how should we plan our internship? How should we plan to read and complete our syllabus in internship? For that, I have the very accurate answer right now. Follow Mission NEET PG 3.0. Here we are conducting labs where we aim to complete syllabus in chunks and give you enough time and build cycles so that you can revise the maximum amount of time. We are planning a 90-day cycle where you will complete your first read, then another 90-day cycle where you can actually cover the leftover subjects and give plenty of ENDs, review, revise, and fine-tune your preparation. And the last 15-day marathon, the final crazy run to NEET PG, where we will sort of complete the entire INI-CET syllabus, the NEET PG syllabus, in 80 hours, 7 days, with all the high-yielding topics done in the last 7 days, which will, give you a very good finesse, a very good polish for the day of the exam. So let's begin from the start. Lab 1, what is it? As an intern, a lot of times you will not have the privilege to review the main notes, to, go back to books, go back to reading each and everything properly. You have to be very smart in that area. What you need to do is quickly go through revision videos here and then understand, okay, I did the revision videos, but still I don't know why in surgery this topic I am still getting wrong. What to do now? Now you need to revisit that specific topic from main notes or a more detailed resource of that topic, so that you can understand the topic thoroughly and never get it wrong. So basically what I want to say is be smart in how you plan your day, in how you plan your approach to each and every subject. You can't go into the greatest depths of each and every subject. Nobody is going to test that do you know Guyton well, do you not know Genong well. Everybody wants you to just tick mark the most appropriate answer from the 4 options available on the screen. So for that, you need to be very smart with whatever you plan your approach to be. Also, ENDs are a massive, game changer because they will teach you how to attempt a question. Why do you think people are getting a rank 1 and a rank 10,000 or a rank 1 lakh? What do you think is creating the difference? It is not she has read more, I have read more, the content here is good, there is worse. Nothing matters these days. The content is almost similar on each app, on each website. What actually creates the difference is, do you know how to attempt the question properly? Do you know how to rule out questions properly? And what actually matters is, do you even know how to read the question properly? So for that, ENDs are the best resource. They will not just, teach you how to attempt a paper, but they will also show how accurate you are. They will also, encourage you that, okay, I need to get this subject done by this day so that I can attempt the END very properly. I really recommend every intern to follow at least one END cycle of any resource you are comfortable with. So here in Lab 1, we have proper videos designed of END, which, wrap up a subject in a very crisp and concise manner, and also teaches you how to attempt a question, how to read a question, how to rule out options. It is a very, very high-yielding practice, trust me on that. Followed by ENDs, we have custom modules, we have GTs, we have lots of PYQ discussions at 11 p.m. So you need to realize that NEET PG or INI-CET, any exam is actually manufacturing the same questions but in a different pattern. The topics will remain the same. You will be approached in like a different way in each and every pattern, of the exam. So you need to be very sure of the topic. You don't need to learn the question, you need to understand the topic. Here's a difference, okay. So for that, we have Midnight PYQ modules where we will go through the PYQ. We will also teach you the PYT so that it is completely ingrained in your head that this is the topic that comes and this is how I approach it. This is the theory of the topic, and these are the questions that were framed in the previous years. In these PYQs, we will cover the recent 6-7 years of NEET PG PYQs, we will cover INI-CET PYQs, we will cover FMG PYQs, all which are very yielding and very essential to be done for the exams you're going to take. After that, till 15th of July, you should plan to complete your lap 1. Even if you are in a very hectic setup where there are continuous 30 hours of duty like I had, it is okay if you're not able to complete your complete syllabus till 15th of July, but try and at least visit each and every subject till 15th of July. That is very important. That you can't skip, because it is okay to do 70% of each subject rather than doing 100% of just 9 subjects by the end of 90 days. Because you will never retain 100% of anything. You are going to retain 50-60% only at the end of first cycle. It is completely normal. By the time you end lap 1A, the NEET PG 2025 results will be out, and then lap 1B will begin. Here, live classes will take place. Live classes will be beneficial, like if I have left certain topics or I am too lazy to read it from the notes, and there's a bit of friction, a bit of inertia in revisiting those topics. It is what you can do is listen to live classes of those topics. They will actually build a good photographic memory, and also it is kind of light to hear videos than reading passively. Of course, listening to videos is sometimes more high yielding than passively going through notes. So of course you can supplement live classes for that. Also, even if you're skipping on live classes, you have to make sure that you give ENDs. Like I discussed before, ENDs are so high yielding. Then we have Marathon INI-CET, which will be this 80-hour, 7-day long, very high yielding, crisp revision where everything will be concised and served to you in a very polished manner, so that you don't get those PYTs and Ratta topics wrong on the day of INI-CET in November. Then we have lap 2 and lap 3, which will prepare you after INI-CET November for NEET PG 2026, so that you have the maximum output. So you must be wondering, or you must be kind of apprehensive that with so many laps, will I get anywhere? And actually this is kind of overwhelming, so many laps, so many revisions. But trust me, if you have this proper schedule designed for you, you will reach somewhere. Nobody reaches completely to the goal. But if you aim to complete that schedule, you will reach somewhere, and that will be enough for you to get a very good rank in the exam, to get done with it in the first attempt itself. So I highly recommend stick with the schedule even when duties get hard. Even if after a 30-hour duty you are made to study, you have to study. Everybody does it. It is completely normal. I remember there were days where I had a 24-hour shift, but I did not go back to my room to sleep. I rather came to the reading room, I opened my book and I revisited topics, I did questions, because that comes from your, that comes from your strong mentality that I have to get done with this. And with a very structured schedule, you are bound to complete your syllabus in a very proper manner and also get highest possible yield out of it. So I would again recommend Mission NEET PG 3.0 for each and every intern out there, because you need a proper structure, you need a proper push, and you will not even believe it when the result comes out, because it is a surreal experience when you are just out of internship and then you crack the exam and then you're starting your PG without a break in life. It is a very phenomenal experience. And also you need to understand that giving yourself that 1 year of academic break in internship is actually going to harm you a lot, because you will forget a lot of things you have worked so hard to remember in MBBS. So it is better to stay in touch with academics always. So I would recommend follow some schedule, be a little harsh with yourself. A little bit of discipline will really, really give you the best possible results. Thank you.